Hello everyone, it's Alice and we're live in Geneva with Maria Marenco, and she flew all the way in from Berlin this morning. And what's interesting about her is that she wears many hats, and I would like for her to share her hat stories. So tell us about your first hat.
Well, first of all, thank you for having me. And I like how you say flew all the way from Berlin, which I feel is kind of like around the corner. Because most of the times I have like longer trips. But yes, many hats. So let's start with why we are here today. So we are talking about blockchain in healthcare and life sciences and research. So one of the hats that I wear is so my background is healthcare informatics, but I'm also a mental health professional.
Awesome.
So that's two hats already. That other hats that I do is I work for an organization called HIMSS, which is a healthcare IT global organization where we are a big ecosystem, that consists of doctors, nurses, business people, and and citizens like us. I also part of the Swedish Blockchain Association, where I lead the e-health and healthcare vertical, and I also lead the Nordic chapter for the government blockchain association. So that's a lot.
That's a lot.
Yes.
And you're from Costa Rica.
Yes. So that also I need my own infographic. So I have mixed Costa Rican and Nicaraguan. I grew up in Sweden. I live in London, and occasionally also in Malta. So,
I love it.
Yeah,
you're a global citizen.
Yes, indeed. I think we all are these days, aren't we? We move around for works and for pleasure and many things.
So I always get the question is like, how do I do it all? How do I travel and go from one country to the next? I always say I am fortunate enough to do something that I love. So for me, it's not work. Do you share that same sentiment?
I do, definitely, especially when it comes to healthcare. So the travel, yes, sometimes it could be a little bit tiring, but the topic itself on healthcare is something that's applicable for us, for everybody. I don't think we should differentiate between patients. We are citizens. At some point, we might know somebody that becomes ill, or we are working to not becoming ill, or just that. So at some point, this will come back to us. So this is something definitely that I would like to be involved and see how we can improve the system, the current systems they are, improve and share knowledge. I would think, and inclusion. It's about inclusion. I think that everybody needs to.
And what do you? So when we talk about inclusion, which groups are? Where do we need to focus more of our energy if we really would like to implement the blockchain technology in healthcare?
Ooh.
Where should we focus our efforts the most?
Okay, so I will start with, so where we will focus on energy will be of having these sort of discussions that we have today.
Yes.
Because, for example, we might have an awareness of what the technology does, but there's also so many things that need to be taken into consideration. For example, the culture differences. It could be, also how we interpret certain things within the healthcare ecosystem. For example, depending who you're talking to, we might have
we might have certain biases or lack of understanding.
Yes. I was
so how do we translate the language of blockchain?
Exactly.
That is standardized and that's relevant to a majority population.
Yes.
That could be digestible information that we could actually use and benefit from.
Yes, exactly. But also something that's not. Sometimes we talk about blockchain like it's a person in a sense.
Mr. Blockchain or Miss?
Yes, it's blockchain. So in Sweden we would say hen because we don't have
because it. I like that. It blockchain.
Yes. So I think it's also not only about the language, but also perhaps I would like to say this. For people there, especially for startups, I think it's quite crucial to also have an understanding about how the process works within, the hospital walls.
Yes.
And because this is also something that could, ease the adoption for this, great solutions that we are seeing, and to not add any more burden, I would say, because especially in healthcare, we are really stressed, to sort of. Make things in time and
be efficient. Always improve the efficiency of systems. I mean, I share that sentiment too because when I was in grad school, we went into hospitals and looked at how if the apps that we were developing at Carnegie Mellon University, if they actually benefited patients and doctors. And we had to follow the nurses and the doctors and see if the interface made sense to them, because we were in the beta period. And we found a lot of resistance from doctors and nurses because of managing not only the understanding their own learning curve, but also understanding that the technology is there to help them save time. And it was difficult for them to understand that, because we found out that the interface, even though it was dummy-proof, it was really developed to be super easy, it was still complicated. Because at the end of the day, technologists don't spend 24/7 in a hospital. So there's some unintended incidences that have to be considered, so the developers can put that into the app and make it really efficient and usable for the doctors and nurses. And I think that's sort of something similar in the blockchain industry, is that whether or not we're dealing with digital assets or currencies or just apps that we're developing on the blockchain, like how do we, does it make sense at the end of the day? And how do we inspire doctors, especially nurses, to use this technology and understand it?
I mean, it's definitely a shared responsibility.
Shared responsibility, yes.
So this could be decomposed in different ways. So definitely, we're looking at, startups who wanted to bring their amazing ideas into the healthcare sector, but it's also, for example, the decision makers at the hospital, that if there is a technology that's going to be implemented, also, there has to be education for the healthcare professional. They need to have some time to... The training for that. Yeah. So that's also something, where will this fit in the business model, for example, of this particular institution or organization? And also, I mean, from a governmental point of view as well, because we also allocate certain part 4 training. For example, in the UK, we can see that the government are allocating a budget for training purposes, for example, within the NHS.
Yes.
So this is something also that needs to be looked at the governmental level, and this is also quite uneven when we look in different landscapes. I mean, Latin America might look in a certain way, what our priorities are. In the Nordics, we have a different system, and then also about culture as well, and how the literacy of digital literacy that people have. So there's a lot of different components there. So it's not easy. I mean, blockchain is amazing with the LT technologies, but it's also, we're still early stage. So we need to really collaborate, have a collaboration. And I know that sometimes we use this word all the time. We need to collaborate. But it's so crucial to make this be something that the benefits of all, and bring this value that it can actually bring.
Exactly. And what was the moment that you had when you woke up one day and you said, aha, this is it, I'm going to be a woman in blockchain? What was the moment?
A global citizen on the block. You know what? I need to ponder on that.
That's okay. That's a good one.
But it's definitely, I didn't have like a specific day when I just woke up like this. But it's definitely, I would like to encourage my fellow ladies out there, for anything, not only for blockchain, anything that has to do with STEAM, I will say, to come in and be part of this amazing ecosystem. There are so many ways that you can contribute, not only, from the techie part, but also, research. And so this is, I think it will be like a general message. So not only for blockchain, but definitely there is an underrepresented group. So, ladies, coming to the block.
Come on in.
Yes, and make your voice heard, because this is what we want to do. We want to spread the word and inclusion and so many other different ways.
Final question is, out of all the hats that you wear, what's your favorite one?
I will say so mental health would be something. So the technology or assistive technologies make these amazing things for us. But mental health is something that I really want to emphasize, because it's something that is not, this is something that we all relate to as human beings. Mental health or mental well-being. I don't want to, put something that it needs to be to a certain condition.
Not another label, right?
Yes. We always been sad at some point, anxious at some point. So these sort of things. So mental health definitely is something that I would like to And blockchain can also help a lot with that as well when it comes to data sharing or fighting stigma and all these sort of things. So mental health for sure will be my number one.
Well, thank you, Maria. There you have it, the lady that wears many hats. And if you like the interview today, please subscribe to our channel by visiting neweconomies.com. Please leave the comments below so we can help spread the word and also to include more women in the space. Thank you very much.